Extract 1. Questions 1 to 12. You hear a physiotherapist talking to a patient called Ewan Hunt. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi there, Mr. Hunt. It's good to see you again. Just to reassure you that I've received your file from Dr. Patel and her letter as well, okay?
Thank you. It's really good to see you too.
Oh, happy belated birthday for yesterday. Am I right in thinking you just celebrated your 60th?
Yes, thank you.
Did you do anything nice?
They made a huge fuss at the restaurant where I work. I kept telling them that I'm too old for all of that, but they weren't having it.
All right. What do you do?
I'm head chef of an Italian on Maple Street. We serve authentic cuisine. You should try it.
I might do just that. So, you've been referred to me to help you manage your condition, and it says here you've been experiencing quite a few symptoms, is that right?
That's right. I've got COPD, probably from all that lighting up I do all the time. I told Dr. Patel about the coughing already, but I suppose the main thing is that it happens a lot more now. Worse still, now I have phlegm too. It's quite disgusting, kind of yellow, green. You already know about the wheezing. That's probably the worst of the three.
Well, I don't want to sound like I'm preaching, but you do know what I'm going to say, don't you?
Course I do. I've heard it all before. You're going to ask me to give up the facts. But it's not that easy, you know. I've been doing it since I was 16.
Why did you start, if you don't mind me asking?
No, I don't mind. Couple of lads on the estate reckoned it was the coolest thing since the advent of the wheel. Once they were doing it, everyone followed suit, so I guess you could say that I was peer-pressured into it, like. Haven't looked back since, really.
I understand. It says here that you attended sessions at the clinic. Didn't they help?
It wasn't sessions. I actually went to a special smoking cessation clinic in Finland for a bit. Cost a pretty penny too, but at the end of the day it didn't work.
Sorry to hear that. I'm trying to think of the best way to help you now. What's your day-to-day like?
Really, I'm mostly fine. I suppose that I do have one gripe. I get a bit breathless and I'm finding it hard to keep up my social life. I've always found the rush at work difficult. Like when diners come in on the evenings and the weekend and everything in the kitchen is intense. But now, even when I'm lifting pans from one end of the kitchen to the other, it's tough. Also, I can't do the things I love anymore, like hiking. Used to go every weekend, but now I get breathless just thinking about it.
Mr. Patel has suggested I can prescribe you with an inhaler if you feel it would help. You can take it as and when you need.
That sounds good.
You'd need to take 1 to 2 puffs a day, as and when you feel the breathlessness coming along. You can't take any more than 4 puffs in any 24-hour period, okay?
Understood.
There's another thing I've been asked to talk to you about. There's a procedure that you could try called endobrochial valve insertion. You've been identified as a potential for it.
Endo what? I can't even say it. What's that?
It's a relatively risk-free procedure to insert a tiny valve into your lungs.
I think I'll pass on that one if you don't mind. You hear all kinds of horror stories of people dying on the OR table these days, especially now that our hospitals are so stretched for staff.
Not a problem. The other thing I suppose is just to echo Dr. Patel's advice about weight loss to you. Happy to show you a few exercises that I think you'll enjoy as much as you did your other activities. Then I guess we can pick up again in 2 weeks' time, see how you're...
Extract 2. Questions 13 to 24. You hear a GP in a student health centre talking to a patient called Jason Bosworth. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, Jason, how can I help you today?
Well, it's a bit of a long story. I think maybe I should have come to see somebody before, or perhaps I should have gone to the hospital when it first happened. I don't know.
Okay, well, let's start at the beginning. How old are you?
Oh, I've just turned 21. I'm in the final year of a sports science degree. As you can imagine, I get plenty of exercise. I'm generally fit and well, or at least I have been until now, and I've not been plagued by injuries at all, not like some people on my course have. So I guess I've been lucky.
I see. So, what's happened to change that?
Well, what happened was I was out cycling. I reckon I do about 100 kilometers a week usually, and I've never had an accident before, but for some reason, going round a sharp bend, I came off my bike. It was stupid, really.
Okay, and how long ago was this?
5 days ago now. I mean, I had a few minor cuts and bruises, but nothing serious, so I didn't go for treatment or anything. Fortunately, I had my helmet on because I did bang my head quite badly. But I felt all right at the time, so didn't think much of it. I was a bit shaken up.
Yes.
But the bike was all right, so I rode home and had an early night.
And you slept okay?
Oh yeah, I was fine. Only thing was, I woke up with a migraine. Now that didn't worry me particularly because I do get them occasionally, so I didn't immediately make any connection with the accident. I just took my normal medication, and as the day progressed, it wore off.
And since then?
Well, I've had no more pain. It's just that I've not been feeling my normal self, really. Like when I was at the gym, I started to get these dizzy spells. Like the room would start spinning suddenly, and I'd have to rest up. I've never had that before.
Okay.
Then at other times, I just don't feel right. It's as if I'm sort of floating. Do you know what I mean? It's as if I'm not quite all there.
Right. And how often do you feel like this?
Well, all the time, really. It sort of comes and goes, but I haven't felt right for a couple of days now. Then sometimes I'm even unsteady on my feet. I have to hold on to something because I think I'm going to fall over.
Oh dear.
Maybe it's just a feeling, but it's not really like me. Then, yesterday, I got home and I couldn't find my keys. I went through all my pockets and really started to panic because I thought I must have dropped them in the street or something. Then I remembered that I was wearing the little backpack I use when I go jogging, and that's where they were. I mean, I never put them in there. I had no memory of doing that whatsoever. It was weird.
Okay. And has anyone else noticed a change in you at all?
Yeah, I went out for dinner because it was my friend's birthday. We went to this really lively restaurant in town, and the noise started to get to me. It was just people talking and laughing and stuff, but I couldn't wait to get out of there. It wasn't really a great night, and afterwards, my girlfriend told me I'd been irritable for a couple of days, which isn't like me, so that's when I thought I'd better come and see somebody.
Sure.
And another reason is that I've got exams coming up, and I'm finding it really hard to concentrate. I've got a lot to do, so I need to knuckle down.
And is there anything else worrying you? Anything else on your mind?
There is another thing, actually. I've got a really big rugby match coming up. I'm in the college team, and it's the regional final. I really want to be fit enough for that, but I'm wondering if I'm well enough to play.
Okay, I'm beginning to get an idea of why you're concerned. What I'd like to do next is to run some tests.
You hear a nurse and a senior nurse discussing a patient. Now read the question.
Joe is doing much better today.
Well, that's good to hear.
Yeah, he's just done his 9 o'clock exercise session. He's got normal movement in his right shoulder now. He performed both rotation and flexion exercises very well.
What about the hip exercises?
He can do the abduction and the extension exercises, but he still has a lot of pain in his right hip. And as for exercises for the left shoulder, he can only do the shoulder flexion to 100 degrees, and he can't do the shoulder extension exercises at all for the moment. I'm just writing up the flow sheet now. Do you need any other information?
Listening Part B. You hear an optometrist talking about amblyopia to parents and teachers at a kindergarten. Now read the question.
I was asked here today to provide important information regarding amblyopia in children. Amblyopia is a condition in which the nerve pathway from an affected eye to the brain is not properly developed during childhood. It is the most common visual impairment among children and affects up to 3% of the young population. However, because only one eye is usually affected and the other eye does the work of both, many parents are unaware of the problem. Fortunately, it can be easily detected with a thorough eye examination, and the earlier the condition is detected, the easier it is to treat. Treatment depends on the particular cause of amblyopia. However, most commonly eyeglasses, prisms, and eye drops or patches are used to blur the vision of the normal eye and force the brain to recognise the image from the eye with amblyopia. Now, the government is offering free eye tests at our centre for medical care holders, so I urge you to take advantage of this offer.
Listening Part B. You hear a nursing lecture talking about side effects to a group of student nurses. Now, read the question.
Today, we are talking about side effects. We'll look at the most common drugs first. As you know, some patients suffer side effects and others don't. And not all patients suffer the same side effects either. Let's consider ibuprofen, for example, a very common pain medication. Some people may suffer dizziness, and others might feel nauseous. It's also possible to have diarrhea, vomiting, even headaches with this type of pain medication. Injecting drugs intravenously may cause swelling at the injection site for some patients. Stomach aches are a side effect of some anti-allergy drugs, as well as loss of appetite and constipation. Patients who take Valium may experience drowsiness, while others may get a rash. Tremors are another side effect of this drug.
Listening Part B. You hear a senior registrar talking about cholesterol to a group of junior doctors. Now read the question.
The average total cholesterol level in the UK is 5.5 millimole per litre for men and 5.6 millimole per litre for women, which is above a normal level. So does that mean that most people need to take anti-cholesterol drugs? In recent years, we've come to realise that to decide whether an individual's cholesterol levels are dangerous, these levels need to be considered in the light of the person's overall risk of heart disease. This overall risk is determined by a combination of factors, including age, gender, family history of heart disease, and whether someone smokes, is overweight, has high blood pressure or diabetes. The higher the risk of heart disease, for example, a male smoker with high blood pressure and diabetes, then the greater the need to get cholesterol levels down.
Listening Part B. You hear an agency nurse checking his schedule with an employee at the agency. Now read the question.
Hi Karen, it's Tyler Brewster. Are you able to give me my schedule for this week?
Sure. Is the afternoon shift okay for you?
I have exams in the morning, so the afternoon shifts are perfect, yeah.
Okay, so you start on Tuesday at 16:45 and finish at 2300. On Wednesday, you start at 15:30 and finish at 22:15. It's the same on Thursday.
Oh, that's good for me.
Are you free on Friday? I need a staff nurse for St. Peter's Care Home in Hillsworth.
I'm not free on Friday, no. But Saturday? I can work on Saturday if you need me.
Saturday. Can you do a shift at the Amazon Hospital?
No problem. What time's the shift? Listening Part B. You hear a conversation between a senior nurse and a student nurse. Now, read the question.
If you give an injection, always throw away the needle in the sharps box here.
What about the cap?
Never recap the needle, just drop it in the box.
Why?
So you don't injure yourself with the needle, and we have a special place where we throw away the sharps boxes. If you want to throw away other material like gauze or surgical tape, never put them in the sharps box. Sharps boxes are very expensive, and we have a special waste room where we throw them away.
Okay, I understand.
And if you take blood, always use disposable gloves. And in the OR, if you pass sharps like needles and knives, never use your hands. Always use a tray.
That is the end of Part B. Now look at Part C.
Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear an interview with Dr. Bob Dean, who's talking about a trial he conducted to assess different ways of treating the condition known as tennis elbow. You now have 90 seconds to read questions 31 to 36.
The condition, commonly called tennis elbow, is a painful condition of the tendons which interferes with tasks involving gripping and manipulating objects. A recent trial led by Dr. Bob Dean has tried to see what type of therapy works best. Bob, is there a typical way that tennis elbow starts?
It's a very common condition, but apart from tennis players themselves and people working in industries where they do certain manual tasks, it's surprisingly difficult for patients to pin down the actual start of the pain. And even with those high-risk activities, it's generally something that comes on over a period of time. In tennis, it used to be said it was down to the player's grip or the type of racket they were using, but nobody's really researched that thoroughly. There are plenty of guidelines out there, but they're not evidence-based. When somebody has pain, then modifying their tools, whether that's a tennis racket or something at work, may well help, but that doesn't necessarily mean there's a causal link.
So what was your approach in the trial you conducted?
Well, we divided our patients into 3 groups. One group followed a physiotherapy program, another was asked to do nothing to see if the condition just went away by itself, the wait-and-see group, we called them, and people in the 3rd group were given steroid injections. The physiotherapy we used was a specific elbow manipulation. The therapist applies manual force to the elbow joint, and at the same time, the patient actually performs the kind of task that causes the pain. The aim is to apply the force in a way that relieves that particular pain. But just as important is the physical activity the therapy calls for, because in most tennis elbow patients, their muscle system's quite debilitated.
And I understand that complete rest wasn't seen as an option? Instead, you described something called smart rest?
Resting is an interesting thing. Immobilizing the arm in a sling is probably the worst thing anyone with tennis elbow can do. In fact, resting most musculoskeletal pain isn't good. What we advocate is something called smart rest, and what this means is being as lively, as dynamic as possible, but not hurting the elbow. An example is where patients avoid picking things up with their palm facing down, which is classic advice given to anyone with a condition. But patients do need the stimulus of movement to help rehabilitation. And so all our participants were given advice on how to manage their condition ergonomically, even the wait-and-see group. The difference was they didn't get any other form of treatment, whereas our other two groups did.
So what were the results?
What we found was that steroid injections were more effective in the first 6 weeks, but not after that. The physiotherapy group also reported good results at 6 weeks, comparable to those for the injection group, and much better than those reported by the wait-and-see group. But then, after 3 months, the situation had changed. The physiotherapy group was now reporting better results than the injection group, and, remarkably, so was the wait-and-see group. Indeed, they were catching up all round, so much so that after 6 months, physiotherapy is no more effective than doing nothing. At 12 months, and what's fascinating is that we're the second study to show this, the recovery rate for people who do nothing was 70 to 80%.
So what does all this mean for patients? What advice would you give them on the strength of this trial?
I'd say, in the first instance, rest the elbow and see how it is in 3 months. If it hasn't resolved itself by then, they're probably one of those 20 to 30% who aren't going to get better. At that stage, I'd recommend they have some sensible physiotherapy. I don't think there's much evidence to support the use of steroid injections until a really good attempt's been made with the wait-and-see approach backed up by physiotherapy. But it's still worth trying at that stage because the alternative could be some quite drastic measures, even possibly surgery.
I see. Now, it's quite common for people to think that if something's sore and swollen, they've got to take anti-inflammatories like ibuprofen. Are they right?
Well, there have been various studies about this, and what they've found is that there's little evidence of inflammation in tennis elbow. So there's no reason to think that non-steroidal anti-inflammatory drugs are going to be very beneficial. So I suspect that just taking basic over-the-counter pain relief would be at least as successful as taking anti-inflammatory drugs, in the case of tennis elbow.
Now, look at Extract 2. Questions 37 to 42. You hear the monologue of a physician giving a lecture on ankle fractures. You have 90 seconds to read questions 37 to 42.
Hello, Doctor. What are the types of ankle fractures?
There are different types of ankle fractures, and treatments vary significantly based on the location and severity of the injury. When a broken ankle occurs, the injury may be to the end of the medial malleolus, called tibia, or to the lateral malleolus, called or both. There are many types of ankle fractures, and let me explain you about certain common types ankle fractures. Lateral malleolus fractures is the ankle fracture that involves only fibula. Most of the lateral malleolus fractures can be treated without surgery if the ankle joint remains stable. A surgery is recommended in case of an unstable joint or the ligaments are damaged. However, the hint for surgical recommendation is when the fibular fracture is within 4 centimeters of the end of the bone. In such case, the fracture can be treated non-surgically if there is no injury on the inner part of the ankle. Medial malleolus fractures involves only tibia. This fracture occurs to the bone on the end of the tibia, which is called the medial malleolus. An isolated medial malleolus fracture is very rare compared with an isolated lateral malleolus fracture. Generally, a displaced medial malleolus fracture is treated with surgery. Bimaleolar ankle fractures involves both fibula and tibia that occur when there is an injury to both the inner and the outer side of the ankle, always resulting in an unstable ankle joint, and surgery is to be recommended for most of the patients with this kind of fracture. Even if the fracture heals without a perfect positioning, the ankle joint alignment will remain disturbed and could result in accelerated arthritis of the ankle. Even after a surgery, ankle cartilage can be damaged at the time of the fracture, resulting in arthritis. Therefore, a proper diagnosis and repair of these fractures is essential to avoid the chance of long-term problems. Although a bimalleolar equivalent fracture involves only fibula, there is also a tear of the ligaments on the inner side of the ankle, resulting in instability of the ankle joint. Therefore, a surgery is essential. Trimalleolar fracture involves both fibula and tibia like a bimalleolar ankle fracture. However, the bone in the back of the tibia called the posterior malleolus is also fractured. At times, if a large fragment of bone is fractured, a surgery is inevitable. Posterior malleolus fracture involves only tibia. This is a rare injury in isolation. Fractures of the posterior malleolus generally occur in association with bimalleolar ankle fractures. In such case, the injury is called a trimalleolar ankle fracture. Mesonerve fracture involves both fibula and tibia, which is a less common injury. However, this injury needs to be diagnosed thoroughly, as there are chances of missing this injury. In this type of fracture, the bone is injured on the inner side of the ankle, called the medial malleolus. The force of this injury passes through the large ligament that connects the two bones of the leg, called the syndesmosis. Since the damage is caused to this supporting ligament, the ankle becomes unstable, and most often a surgery is recommended. This is the end of Part C. You now have 2 minutes to check your answers.